Today on The Ascent Health, we are talking about pelvic floor therapy or pelvic health. I have Dr. Laura Huie on. She is a physical therapist. She specializes in pelvic health for females. So we are talking about what is pelvic health, who needs to be aware of it, things like leaking urine when you're, jumping on trampolines for one, or just in general pain during sex. Constipation issues can be related, urgency to pee, all kinds of fun and interesting things. So she's answering questions for me, answering questions that I know many other women are asking. There's obviously changes that happen during midlife with our estrogen decreasing that affects pelvic health, sexual health. So we're talking about that. We're also fact-checking, going back to the Aspire Med Spa podcast on the Emsella chair. It's one of those things that I knew that physical therapists might have different opinions on, so I wanted to get Dr. Laura's opinion on it. So this is going to be a really fun episode. Let's dive in. Hi everyone, welcome to On The Ascent Health. I am here today with Dr. Laura Huie. She is a physical therapist at Point North Physical Therapy. Laura, welcome to the show.
Thank you.
So can you share a little bit about your background and then specifically what got you into pelvic health, which is what we'll be talking about today?
Yeah, so I have been a PT for about 10, 11 years. I've worked in about every setting you can. But now I specialize in pelvic floor therapy in outpatient. So yeah, I think when I started doing outpatient therapy, I was just kind of drawn to working with women mostly. And prior to doing outpatient, I loved being in the hospital, working with people because that just seems like their most difficult time. And so I really loved that personal connection and helping them through those struggles and difficult times. And that's kind of not the nice piece, but that's the deeper part of pelvic floor therapy is that they're a little bit more personal issues, and I can kind of work on more the whole person rather than like just a joint pain. There's just a whole lot more that goes into pelvic health. So,
and do you feel like I feel like pelvic health is not well discussed?
Right. Yeah. So that
why
is
is
fun
that?
to me too. Is that there's just so much, even as a therapist, like there's just so much more to learn about, and there's lots of good research coming out about it. So it's been done for over 20 years, but there's still more extensive research that needs to be done. And so I find it fun to do that research myself, but then to also educate people and share with people what they can help themselves.
So what is pelvic health? What kind of issues are pelvic, I'm going to screw up words today, pelvic health that people should be looking for or should be thinking about?
Okay. So really like anything related to your pelvis. So in your pelvis, of course, we've got our bladder, we've got our vagina, our colon comes down into our pelvis. You've got your sacrum, your coccyx. So, even tailbone pain can be seen by, for a pelvic floor therapist. Anyone that's having issues with constipation. So our pelvic floor plays a big role in managing bowel movements. If you're having trouble with any urinary issues, so emptying your bladder, or maybe you're going to the bathroom too frequently. Of course, we've all, heard about leaking, that you don't necessarily have to have children in order to have issues with leaking, but that is definitely a big one that people get drawn to pelvic floor therapy for. Pain with intercourse is important to address. I'm sure there's other things, but yeah, it's a wide variety.
And let's talk about some people consider leaking, it's a normal thing. Like as we age or after we've had kids, we're going to have this issue forever. Right. Could you clarify that? Like, is that common? Is that normal?
Yeah.
What should be happening?
Common and normal, right, are not, we know that's not the same. It can be common. It is definitely not normal. So I would definitely encourage that if you have had any type of leaking, even if it's just like a little dribble, it happens, maybe just a couple times a week, or maybe every day you have to carry a pad with you, or you have to change your underwear, or you're worried about where you're going to go if you are going to be running or jumping. Definitely get that taken care of. It's not something that you should just have to deal with.
Right. And
it's something that can be helped, even if you have been doing that for 10 years or so. It can still be addressed.
Right. And I feel like maybe when Depends came on the market, they kind of made it seem like, oh, this is normal. Just, get Depends. And there are people who need it, but there are a lot of people where pelvic floor therapy could help, and they wouldn't have to do that. How about pain during sex? Normal, not normal? Do some people think that it's like inevitable after, childbirth or after certain things.
Right. Yeah. Also, definitely not normal. And there's a couple different things that can cause that discomfort. So where we can have tension in our pelvic floor, so that tends to be a really big one. And of course, dryness. So after someone's gone through childbirth, and if they're still breastfeeding, that estrogen is still low, so you can get some vaginal dryness. Of course, we mostly all know that with menopause, our estrogen is dropping down, so that dryness can be really irritating to people. And then even just in your 30s, 40s, as we're starting to experience some perimenopause symptoms, we can also experience some of that vaginal dryness. So I would, usually that dryness in combination with or not in combination, those alone can cause some discomfort with intercourse, and that's something that you can definitely get help with.
And so you as a pelvic floor therapist, though, do you help with dryness or just the muscle tightness? What is your role, and what does like pelvic floor therapy look like?
Both. So typically in pelvic floor therapy, I don't know, do you want me to just go over like what
it would
an exam looks like? Okay, that might just be easier. Yeah. So usually when someone comes in, a lot of it is talking, because there's just so much that we want to cover. So, we find what's the main thing that brought you in that's really bothering you. And then we'll talk about bowel issues, bladder issues, what is our diet like, what's our fluid intake like, certainly any medical history that could be contributing to it. And then depending on where we're having these problems, typically want to do a vaginal exam. So with a vaginal exam, it's not like when you go to your gynecologist and you've got a gown on, you've got your foot up in some stirrups, and then they take this big speculum, and then
which is very uncomfortable.
Yes. It's not like that. It's I do an external assessment where I'm saying, can you squeeze your pelvic floor? Can you relax? Can you do a bear down and kind of bulge? And then with a gloved finger, we're feeling each layer, the superficial, intermediate, and deep layers of the pelvic floor. So looking at that coordination of the pelvic floor is really important, so that if we're having a tension issue, so meaning the pelvic floor is so guarded, it's keeping its own contractions and tensing. That's something you may not even feel. That's going to cause problems with intercourse.
Right. It's like muscles that don't relax.
Right. Yeah. So like if you are trying to have intercourse, it's going to be really hard to have penetrative intercourse if the muscles are having a hard time relaxing initially. If you need to have a bowel movement, our pelvic floor needs to relax to have a bowel movement. Same with voiding.
Yeah.
Relieving our bladder. And then of course, if we're having weakness, that can affect, how is our pressure management. So when you go to pick up something heavy you're carrying in groceries, you're coughing, you're sneezing, that's where sometimes people experience some leaking. So not to say it's either or, like I have seen people that will have leaking and they have tension in their pelvic floor.
Right, I've heard of that too. Like in athletes, for example, can happen.
Right. That is really common. So that's where that exam is just really beneficial, just to see what is the quality of the contraction of the pelvic floor, and are we able to relax the pelvic floor? Like all of our muscles will have some kind of relaxation and also some tension. So you don't want it to just be stagnant in one position all the time, because then it's not doing its job.
Very cool. And then treatment, what does it look like?
So treatment is you are definitely not coming in and just getting like a vaginal exam every time.
It's not just like massaging there and hoping.
Really, like the first exam, I normally tell people like, I would like to do an exam. We'll do it next time. Yeah. Some people don't even know that an exam is part of pelvic floor therapy, so I like to give them a little warning. I feel like most people they like to be warned if they're going to have a pelvic exam. So, and then going on that note, like what else is included? So I'm also going to look at your spine range of motion, your hip range of motion. What is our core strength like? How are we breathing? Diaphragmatic breathing plays a really big role in pelvic floor therapy and how our pelvic floor is going to function and move. Look at the core strength. I don't know if I already addressed that. And hip strength. So some of our hip rotators are really closely connected with the pelvic floor.
Right.
So then looking at treatment, depending on where we're having restrictions, we might be doing a lot of hip mobility and stretching. It might be more breathing and relaxation focused. We might have to be working on really focusing, addressing the core weakness. How are we bracing properly? Do our hips need to be strengthened more? So that's what makes it really fun, is that, depending on what we see And what I hear in the exam, it really dictates where we go. But yeah, you could walk into a PT gym and have no idea that someone is there for pelvic floor therapy because they're also right next to the person with knee pain, and they're lifting kettlebells and doing different core glute exercises. So there's a lot of fun variety.
Yeah. Do you know how common it is for people to have pelvic floor issues? Do we have any idea what percent of women post having kids?
And I don't know. I would say after having kids, the majority are going to feel some kind of, I would say, pelvic floor dysfunction.
Right. And like one of the things that I learned is like people who have C-sections tend to have more pain with intercourse after, which I thought was fascinating, right? Like we haven't had our vagina stretched open to the same extent, but maybe because it didn't get stretched, it tightened down even more. I don't know what the fact, or because our core was cut through. But that was an interesting fact. And it's like a huge percentage of people with C-sections end up with that.
And with the C-section, I think people assume like, oh, well, like that C-section, that really sucked. But that means I'm not going to have any leaking. I don't have any prolapse. Like, yeah, unfortunately, you're not out of the woods for that either. Because you still went through 9 months of carrying a child and your ligaments, your body needing to stretch and allow room for that. Your pelvis is still preparing for childbirth, even if you have a scheduled C-section. And then, unfortunately, if you had emergency C-section, you might have been laboring for a long time. So that's still some pressure that was on the pelvic floor and all of those ligaments. So, yeah, we can still end up with some dysfunction there. Childbirth, if, of course, you've had a vaginal delivery, more likely than a C-section to get prolapse. But, it doesn't mean that you're totally in the clear, unfortunately. So that's why it's good to kind of listen to your body and not just accept that everything's going to be normal, and listen to those pains and difficulties you're having and get help.
And then let's talk about like Kegels, right? Everybody knows Kegels. What role do they have in physical therapy? And from there we'll check on the Emsella chair and your thoughts on that. But
so Kegels, they do have a role. They're not the only
the one and only answer,
right?
Too.
Yeah. So some people, like ones that are having constipation issues, or if they're having pain with intercourse, I very rarely am doing Kegels with them. And even those who are having
because they're tight enough typically.
Yeah. So their pelvic floor is essentially, Kegeling, you think of a Kegel as you're squeezing in and you're relaxing. They're just staying squeezed in, even if they don't feel like they are. So even with those that are having weakness issues, and maybe we need to do some Kegels, even just core and hip strengthens your pelvic floor as well. So there have been studies that have shown by strengthening adductors, strengthening your glute med, strengthening hip rotators, that can strengthen the pelvic floor as well.
Clamshells.
The classic clamshells. Yeah.
Okay, and the Emsella chair. So I talked to someone at Aspire Med Spa. She was talking about this Emsella chair, which was, I don't remember how many thousands Kegels. It, basically caused a woman to have, 30 minutes of sitting on a chair. What are your views on that? Who is it for? Who should be careful?
Yeah, I would say most pelvic floor therapists are not really fans of the Emsella chair, but we're also just not fans of something that's a passive treatment where you're not being examined.
Yeah.
Like we don't all fit, even if there's 5 in a room and we all have leaking, not everyone's going to fit into that one box.
Right.
We could all be leaking at different periods of time. Like we really need to assess what is causing our symptoms and at what times of day. How much load? Is it just a little bit or is a lot that is causing the leaking? So that's what's hard with these passive treatments, like an Emsella chair, where it's just a one size fits all, that, is most likely not going to help. It might help in the short term, that if we are having weakness, it could maybe give you a little bit of relief, but we need to be retraining those muscles and teaching them what to do. So, think about like if you had someone just like moving your arm up and down, like even if your biceps contracting, you still I'm going to have to teach yourself how to actually pick up weight without those pads touching you. So So I'd say even if you want to try the Emsella chair, I would still recommend seeing a pelvic floor therapist or talking to your provider about
Right, because what if you're already really tight? I think that was my concern.
Yes.
Like,
so then if you're having tension and you may not even know that, you might just feel like, oh, I'm leaking some. I probably need to strengthen your pelvic floor. Well, if your pelvic floor is already really tense, it's not going to be able to contract anymore in order to maintain continence. So then if you add something that's requiring your pelvic floor to contract 1,000 times, that's a really bad idea.
Yeah.
It's already
you might fatigue it in the end, and then maybe it's forced to. I was like,
but yeah, I would not recommend that. And that's why doing an exam, I don't hate to say it, but maybe people don't always want to hear that. That's why the exam is so important, because we don't always know what the coordination of the pelvic floor is. And some people just don't have very good awareness of what their pelvic floor is doing.
Whether or not they can actually relax it, or so like mine, when I had it was great fun. The physical therapist also had an intern that day, so basically they're doing it and just talking about it. I think I was pregnant with my first kid, so it was like part of like just getting used to it all. I'm like, whatever, but like they made me like laugh, right? Because I think that's somewhere where people have issues. I had to sing, right, and then like the relax, the squeeze, the like. Of course, I thought it was fascinating, but it is a very personal moment.
It is.
And it is. How about for males? You do it for males as well? If
I don't.
Women, you don't do it at all?
I don't.
Okay.
So of course, when we graduate and get our DPT, we talk about pelvic health. There's some cursory things that, we'll learn about and how to screen and treat. But it is additional training in order to become a pelvic floor therapist. And there's different levels of certifications. So the first course is for women, and there's a separate level for men's pelvic floor, and I just haven't done the training yet. We don't always get courses that come up here, so it's time and money, and so I'm just kind of ticking the way through. Yeah. And the point is,
males also can use it, right? It's super helpful after, I think, prostate surgery, right? They tend to have leakage then. And men can have very tight pelvic floors.
Pain in their pelvic floor. They can have constipation issues, right? They can get leaking, even before having prostate surgery. So, and we do occasionally get calls to our clinic, and so I'll kind of screen them to see if it's something, just with my knowledge of women's pelvic floor, and actually I treat children as well. So I have treated some young boys with pelvic floor issues, but if I speak to a man and I feel that they need more of an extensive exam, then I recommend they see a male pelvic floor therapist or a pelvic floor therapist that treats men for their conditions.
Got it. Let's see, anything specific like women's in their 40s and 50s should know about pelvic health, and is there a way to like kind of take good care of your pelvis and pelvic floor?
I would say, even just getting into your 40s, that's when we can start to get some perimenopause symptoms.
That's what everybody's telling me. It keeps coming up on podcasts.
Yes, and it's something that not even pelvic floor therapists need to know or do know, but anyone that's working in orthopedics, and that's even orthopedic surgeons, primary care doctors, other orthopedic PTs, chiropractors, like we're all seeing women. Right? So if someone's coming in and they're in their mid-40s, they're in their 50s, and they're having this joint pain that's just not going away, they have this really bad tendinopathy that's just really irritable. That slow decline in estrogen is going to affect our joints. So I would say that if you're in that age group, kind of listen to those changes in your body and really address them like as early as you can, because it does show that doing resistance training before we're getting into menopause can really help with that prevention of that muscle loss, helps with maintaining bone mass or bone density and muscle mass, can help with your hot flashes if we're exercising. So kind of getting ahead of those symptoms is helpful. And even if they are really bad, like it's never too late to go in and talk to your doctor or seeing a pelvic floor therapist. So I know that was a long-winded answer. But like joint pain, I think that's something that many women probably don't think of if they're thinking of pelvic floor issues, or if they're like, oh, maybe I'm getting close to menopause. They're probably not linking it to like, oh man, but this hip pain
they just seem to think
really bothering me.
They're like, oh, it's the part of getting older, right?
Yeah.
They just assume.
I've had like a fair amount of women in their that they're like, no, this pain just like is not going away, and I used to be able to, and they're still really active women. I mean,
Right.
like, all women are up here, they're
Yes.
crazy, you know, so they're really just bothered by like, oh my gosh, I fat bike and I mountain bike all the time, I'm a cross country skier,
Why do
like I run
hurt?
marathons, but like, why is this hip or this knee still really bothering me? And that could be
Hormonal.
it could be part
Something.
hormonal. Certainly we talked about vaginal dryness,
Right.
leaking.
What
yeah.
does like pelvic floor therapy do for vaginal dryness?
So
how does
strengthening
it
your
affect
pelvic
that?
floor does help with lubrication. So if you're having dryness, that is helpful. So yeah, going back to that painful sex, of course, it's relaxing the pelvic floor. So then if we can get the pelvic floor to relax, we do want it to be strong as well.
Right.
So then that can help with your vaginal lubrication and arousal,
Yeah.
which of course is important with sexual health. And then if the vaginal dryness is due to that estrogen, then that's when I recommend they talk to their primary doctor about a topical. Those are very, very helpful. And of course, just lubrication. Definitely use lubrication.
Very
on top
cool.
of that. Yeah.
Okay. And then just for you personally, I don't know how old you are, but like how is staying healthy as you age important for you and why?
Oh my goodness. I mean, I think just being as a PT and you're just aware of all the things that can happen. It's,
That's fair.
yeah, you know, and now I have a toddler,
Right.
that's about 36 pounds. So,
Yeah.
you know, when she's wanting me to hold her, but also like bend down and pick up a toy of hers, like if I go to the gym, I'm like, okay, like I'm going to put away that 20-pound kettlebell. Like I have to pick up the 30 or 40-pound
Right,
kettlebell
because that's how much my kids
more
weigh.
functional.
Yeah.
You know, so it's important for our mental health, of course, you know, for our strength and preventing frailty in our older age. Yeah, I mean, most PTs, chiropractors, we're drawn to the field because we care about our health and we get enjoyment out of being active and
Right.
taking care of ourselves. And so it's fun to share that with our patients and encourage them to stay active. So
Right, and not just like, oh, you're having pain because you're getting old. No, like
Right.
there's a cause to your pain.
Absolutely.
Let's find
Yeah.
it. Let's address
Yeah.
it so that you can.
and same
you
with
know,
women that are older and they're like, I'm old, like that's why I'm leaking. Like, no, like
right?
yeah.
Because there's women who
Women's
do
in their
that.
70s, 80s, like we can still work on things. I think it's like more important to address those problems.
And how do people find you if they're interested in working with you?
We have our website, pointnorthpt.com, so you can check out our website, you can schedule online, you can text our phone number. So if you go on our website or if you Google us, Point North Physical Therapy, we've got pretty easy ways of getting in touch with us.
And you guys
certainly.
take all the major insurances, and yeah,
Yeah.
they have a really nice facility too.
We
So
do love our
highly
facility.
recommend it. Anything else that you would add that we've missed out on today?
No, I don't know. Just
No breaking news. Any facts like or myths you'd like to bust on?
myths. I mean, we
Besides
talked
Kegels.
about- right, we talked about Kegels. Leaking is not normal. Oh, I thought this was interesting. One patient was like, I heard you're not supposed to, it's bad if you have to pee every hour. Like, yes, you should be able to hold your bladder longer.
Right.
So high urgency.
Unless you're
that
pregnant,
is-
it's okay to pee every hour
yeah,
when you're
that is
pregnant. Yeah.
different. Yeah. So of course, you know, maybe look at the fluid. Is it clear or is it like, or if you go back to the bathroom, let's say you just peed and then 20 minutes later you feel like you have to pee again and then you pee for like 2 seconds,
Right.
you probably have a little overactive bladder. So count your seconds when you pee.
Count it. All right.
Yeah. Shoot for like 10 seconds. 10
I think I should
seconds.
start
Your
counting.
bladder probably was right. You did need to relieve your bladder, but
Yeah.
if you're going in and out of the bathroom, that's something that we can.
If you're like about to run a race, does that like stimulate hyperactive bladders? Like if I'm running like a 5K race, I have to pee like 6 times
I know,
before
I
the
think that'd
race.
probably be more like just your nervous system
Yeah, it must
is
do
getting fired up.
something.
Yeah. Kind of like marathon runners, like
Yeah.
when it like upsets your stomach. Yeah. More of that nervous system response.
I was gonna say it only happens to me
Because
when I'm
certainly,
in a
like,
race.
right, when you're running, I mean, that's your sympathetic nervous system. So that's opposite of that.
Yeah.
Parasympathetic, which helps us relieve. So
Something
you'd
weird.
think it wouldn't. But yeah, just in case peas, be careful of just in case peas. We try to not promote those. So sometimes that can kind of lead into more of a overactive bladder.
Okay.
So that's fun that there are ways to retrain your bladder.
Awesome.
Yeah, and that connection with your brain.
We'll do another podcast. Thank you so much.
Yeah, thank you.
Thanks for listening to On The Ascent Health. If you enjoyed today's episode, make sure to subscribe so you don't miss what's coming next. And if you found it helpful, share it with a friend and leave us a review. It helps more people discover the show. The views and opinions shared by guests on this podcast do not necessarily reflect my own or that of Ascent Health and Performance. The information provided is for educational purposes only and should not be taken as medical advice. Next week on The Ascent Health, registered dietitian Kylie Viens joins me to talk about something we all need to hear: how not to be on a diet. We break down why diet culture fails, why willpower isn't the problem, and how to build a way of eating that actually works in real life. If you're tired of starting over every Monday, this episode is for you.